Hi, this is Dr. Gullberg. Thank you for joining us on our Mnemonics series in internal medicine. Today we're talking about bites that humans get from different species of animals or creatures, and also the bacteria that are associated with those particular creatures. So this is a common problem we see in the hospital of infections related to these bites. So let's review. Our patient presents to the emergency room after a cat bite 3 days ago. The left wrist is involved. The patient has swelling, has severe tenderness and redness, as well as fever. You suspect septic arthritis from an organism called Pasteurella multacida. And Pasteurella multacida is a common organism associated with cats. But if we look at the big picture of bites, the word parched can help us as we go through a series of differential diagnoses. Parched, P-A-R-C-H-E-D. So P is for primate, and we're talking about a monkey bite in this type of a setting, and that's caused by herpes virus simiae. Herpes virus simiae. Remember monkey bites for that. A is an alligator. So Aeromonas hydrophilia and Clostridia are notoriously associated with alligator bites. For these organisms, we would use quinolones, Bactrim, or IV cefepime. R stands for rat. So there's a couple of bacteria that are associated with rat bites. These include Streptobacillus monoiformis, as well as Spirillum minus. Augmentin and or doxycycline is good for this type of a bite. C stands for cat. 80% of bites become infected. And of course, we have to watch for septic joints and osteomyelitis because of the sharpness of cat teeth. Pasteurella multacida is the main organism here, and we would use augmentin or cefuroxime or doxycycline to treat this particular bite empirically. H is for human. So oral flora can cause 85% of infections related to human bites, but we also have to remember Eikenella corrodens, which occurs in about 15% of bites. We use augmentin or clindamycin with Cipro or Bactrim for Eikenella. Then E stands for Eikenella corrodens. Watch for this organism in human bites. It's resistant to clindamycin, flagell, and first-generation cephalosporins, as well as nafcillin. D stands for dog bites. 5% of dog bites get infected. Remember, dogs rip tissue more than cats do, thereby leaving the tissue open for drainage. The organisms associated with dog bites include Pasteurella canis and Capnocytophaga. So be careful with both of these organisms. We would use augmentin or Clinda with a quinolone in treating these bites empirically. Don't ever forget about using a tetanus shot in these patients. Irrigate all the wounds thoroughly, and if suturing is required, don't suture these wounds tightly. So thank you for joining us today in our mnemonics series. The word is parched, and the topic is infections and bacteria and viruses that are related to bites that we humans get from other creatures. So thanks again. Have a good day.